Доброе утро, добрый день, добрый вечер, дорогие участники.
Good afternoon, good morning, dear participants. Welcome to our workshop titled Disinformation in Kazakhstan during pandemic. I'm Edward Lemon, head of Access Institution. It's a non-commercial organization, an institution established in Washington last year in order to promote academic exchange between Central Asia and other regions of the world. We're happy to host this workshop in the framework of our cooperation, and we have simultaneous interpreting into English or Russian. If you'd like to use interpreting, you can please click the interpretation icon and choose your preferred language. Today, we have brought together a wonderful panel of experts. Our moderator is the Professor Nargis Kasenova. Professor Kasenova is the senior scientist in Eurasian Studies at the university. He works at the Department of International Relations and Regional Studies in Almaty. Professor Kasenova, I'm giving the floor to you. Thank you very much, Ed. I will be moderating in Russian. Maybe we have to make an announcement in English.
Button. So if you want to listen to the event in English, you can press it and choose the English language, and you can also post your questions both in English and Russian in the Q&A. Okay, and now I switch to Russian. Всем доброе утро, добрый день.
Good morning, good afternoon, everyone. And today we all came together in order to discuss a very interesting and important topic, disinformation in public health care due to coronavirus. And as we know, the pandemic is extraordinary, it's an emergency in many points of view. There's a lot of false information about treatment, vaccination, created and distributed on purpose or without such purpose or critical evaluation, and the WHO called it an infodemic. Combating it. The problem is global, but it has certain specifics in various places, particular places. We'd like to talk about the situation in Kazakhstan today. In our today's Zoom room, we have wonderful experts who will help us understand better what is going on, what can be done and should be done. We have here today Jordan Wilhelm, the CEO of Critical Mass, who quite recently finished the study on disinformation of Russian origin due to coronavirus, and in that study I focused on Kazakhstan, Ukraine, and Georgia. We have Tinatin Japaridze, the head of policy and strategy of the Critical Mass organization. Also Vyacheslav Abramov, the journalist and editor, the founder and editor of the online magazine Vlast.kz on economics, politics, and social issues, and Asel Mutabekova, a virus scientist, the popularizer of science, and the volunteer of the project MediaNet. She studies the strategies and communication in the sphere of vaccination. Thank you very much for being here on the panel with us. And let's begin with a presentation by Jordan and Tinatin. Please share the results of your study with us.
Thank you so much, and hello, everyone. As mentioned, my name is Jordan Wilhelm, and I'm with the Critical Mass, a company based in Alexandria, Virginia, near Washington, D.C. Thank you so much for inviting us to today's event, and many thanks to the outstanding Oxus Society for Central Asian Affairs for all of their leadership and work to support discourse and foster connections like this event today. The critical mass, as the name suggests, is focused on assembling cross-sector, global, and whole-of-society teams to address security and stability challenges. The Global Engagement Center of the United States Department of State identified that Russian disinformation operations are a shared worldwide threat, but wanted to understand and shed light on the true and tangible human cost that it's having, especially during this pandemic. What struck us most during this research was that at its worst, medical and health and misinformation cost patients, doctors, and others time. In healthcare, time is one of the most critical elements to achieving positive results or preventing worsening conditions. And even absent a political goal or agenda, causing confusion or delays can be incredibly damaging. At this webinar, we are thrilled to present some of our initial findings and insights provided by experts, citizens, and web analytics, with the hope that some of this information will assist you all in the next and most important step, which is formulating plans to counter dis and misinformation and its impacts. In doing this research and continuing this conversation, we were so fortunate to work with individuals, mentors, and organizations such as the Oxus Society. Chief among these is Brief, the Kazakh research firm that did our fieldwork on the ground, the Harriman Institute at Columbia University, Abrima Research, the team at the Global Engagement Center, and LukeMe Web Analytics. Finally, leading this team and assembling all of this information is Tinatin Japaridze, who has done some exceptional work. We've been honored to have her leading the research, and we're very excited to hear what she has to present today. Once again, thank you so much for your time and participation, and we're so excited for today's event.
Thank you so much, Jordan. Tinatin?
Thank you so much, Jordan. Thank you, Nargiz. Я в двух словах, если можно, хочу высказать наше...
Briefly, I'd like to express our gratitude to all of you, to Oxus Society, for inviting us. We have wonderful speakers, and I am extremely happy to be with you. I'm looking forward to hearing your presentations. Thanks in advance, and thank you for being here joining us. I will bring my presentation on screen, and will speak to you in English, if I may. Just a brief moment.
This is all visible, yeah? Wonderful. So without any further ado, I will jump straight into our objectives of our project, since Jordan already introduced the project itself. So the objectives for our research as we were going into it in September of last year were as follows. The first objective was to research and identify Russian origin disinformation narratives and campaigns targeting critical health issues, demonstrating Russia's exploitation of epidemics, pandemics, and health crises, focusing on Central Asia and Eastern Europe using key case study countries as noted earlier. Kazakhstan was one of them, as well as Georgia and Ukraine. Our second objective was to increase the awareness of public health officials, decision makers, and the broader regional audience to the malign health-related efforts of Russian origin disinformation and the real-world effects that they have on human lives. And the third objective was to produce high-quality and engaging products to disseminate research findings and recommendations to whole of society in case study countries. And our event today is certainly part of this third objective, so thank you all again. The methodology, which I will introduce briefly, consisted of four different sort of moving parts, four elements. Our research team used a mixed methods evaluation design consisting of literature review, desk review, media diary, expert in-depth interviews with over 50 experts in media, the medical field, and civil society leaders, as well as web scraping. A TCM design project research and engagement plans to investigate the impacts of Russian origin disinformation on trust and efficacy of national public health institutions and initiatives in the neighboring states. And the report is currently in revision. We look forward to sharing it with you all soon. It's in review by the US State Department and Global Engagement Center and is scheduled tentatively for release at the end of this month. So we're very much looking forward to it. Now on to some of the themes that we have identified, and I will be focusing primarily on Kazakhstan as our case study for today's discussion, but wherever applicable, if of interest to you all, I will also mention, just for comparison, some of the findings in terms of the statistics in Ukraine and Georgia. So the first trend that we identified through our conversations with the experts, as well as the media diary participants, both Russian state-affiliated actors and local actors exploit the domestic situation and unrest, as well as the outbreak of the global pandemic, to push disinformation and increase its influence in the region. In Kazakhstan, I should also note, unlike Ukraine and Georgia, the term misinformation was used more frequently than disinformation. And obviously in Russian, Disinformation is frequently, if not always, used for both mis and disinformation. However, the interviewers asked the interviewees, the experts, if they could actually specify whether they meant disinformation as intentional spread of malinformation or unintentional. So that's how we were able to distinguish that in Kazakhstan, the term misinformation was used far more frequently than disinformation. The state government selective misinformation often targets political opposition groups, according to the experts. High-profile issues with Kazakhstan's COVID-19 reporting statistics have additionally damaged public trust in government data, and this will be discussed by our distinguished speakers today a bit further. The country's one-party system and the strictly controlled media environment mean mainstream media shows only one point of view about health and medicine that often contradicts what people are witnessing. This, according to the experts, leads them to seek out other information from unofficial and or unverified sources and makes them more vulnerable to disinformation. In terms of specific numbers, notably 72.2% of respondents whom we interviewed in Kazakhstan emphasized that language and information dissemination matters more than political orientation of the source publication and creating potent messaging. Now, language kept coming up in all sorts of other research findings that we were observing. And just for comparison, in Ukraine, 36% of the respondents in the media diaries preferred Ukrainian, while 32% preferred Russian or had no preference whatsoever. The second trend that we observed was that the pandemic has weakened public confidence in official institutions and shaken faith even in traditionally trusted authorities, decreasing the credibility of their public health messaging efforts. 66.6% of the respondents in Kazakhstan, compared with 76% in Georgia and 44% in Ukraine, whom we interviewed for the study, state that they have little confidence that their governments or civil society organizations can counter it meaning disinformation and misinformation effectively. Furthermore, due to the low trust in public health institutions, misinformation has a sharp rise in self-treatments that endanger patients' health and further complicate interactions and trust building between the patient and the doctor. 38.8% of respondents in Kazakhstan elaborated on the impact of misinformation on their personal lives and the health of their loved ones, while 55.5% of them blamed lack of professionalism and appropriate education of medical personnel rather than specifically misinformation or disinformation per se. The third trend that we identified was that the in-depth interview respondents identified corruption and not politically motivated disinformation as a main cause of low trust in doctors, a problem that has worsened during the pandemic, according to the experts. Corrupt and fraudulent schemes were cited as targeting the most vulnerable groups, particularly the elderly and pensioners in particular, as well as low-income rural youths with lower levels of education. With the development of digital technologies, these groups have gained access to numerous sources of information, which they seldom filter or question, according to the IDI experts. These socially vulnerable groups may not discriminate between fact-based and anecdotal or folk solutions, and will often defer to self-medication and home remedies, relying on household sources and resources. And this was, again, mentioned as sort of a lamentation by the medical experts whom we interviewed. And the fourth trend identified through our research was that the respondents reported very few local countermeasures against Russian origin disinformation in particular. Doctors and other medical professionals may be perceived as sources of misinformation and disinformation, again, among older generations more so, due to lack of both expertise and access to evidence-based scientific resources. While 66.6% of the in-depth interview respondents never encountered events or activities aimed at combating health disinformation, several of the medical experts whom we interviewed mentioned organized meet and greets with journalists to report COVID-19 related news and medical subjects. And more specifically, some actually mentioned explicitly Fact Check Kazakhstan as one organization that is engaged in confronting mis and disinformation. And that's something that I'm sure we will be discussing a bit further with our panelists. Now, in terms of the recommendations, we use the term recommendations, but really these were responses, suggested responses and mitigations that were voiced by expert respondents in Kazakhstan. So by no means are these recommendations by TCM, but rather we're sort of the messenger highlighting some of these suggested mitigations that were voiced by the local experts on the ground. The evaluation report was compiled in approximately a 6-month period. So we started in October of last year and ended the actual field research at the end of April. So recommendations included were collected from available research and expert interviews, as noted earlier, and are shared for reference of decision makers. End users of our report are certainly encouraged to form their own policy recommendations. I just wanted to highlight that, taking in the empirical data in this report and of course supplementing it with other available sources. So without any further ado, I will jump into some of the recommendations voiced by the experts in the country. The first was to expand training programs for medical practitioners and patients to counter COVID-19 mis and disinformation. According to medical experts in particular who were interviewed for this study, doctors are not provided with sufficient tools to counter disinformation on anything more than an ad hoc individual basis, while patients are often left to navigate their own diagnoses in an informational vacuum that forms as a result of lack of information and specifically reliable information. Patient education can play a crucial role in reducing misinformation, according to the experts, as well as increasing confidence in individual practitioners and the medical sector in general. To this end, an increased focus was recommended for the Ministry of Health in establishing and maintaining contact with regional medical associations to either offer or coordinate continued medical education for local physicians in Kazakhstan. The second suggested mitigation was to improve transparency and message efforts to reduce corruption within the Kazakh medical sector, which again, as I noted earlier, corruption kept coming up as a very problematic factor throughout these interviews. While it's of course difficult and we're sort of asking for almost an impossible to eliminate corrupt networks overnight, experts did posit that ensuring adequate compensation for healthcare providers would be an early possible step for increasing the retention of practitioners and cutting down on corruption, and specifically bribery was mentioned as sort of one of the forms of corruption that was most problematic, as observed by the medical practitioners in the country. And the third suggested mitigation was to coordinate counter disinformation and misinformation efforts between local trusted institutions and the international public and private health sectors to achieve a timely whole of society response. A global health crisis, as we saw over this past year, requires a global health response, of course. And so the fight to counter regional medical mis and disinformation would benefit from a joint international effort, according to the experts in Kazakhstan, and coordination leveraging the international public and private health sectors in tandem with the regional counterparts who are on the ground. By building standing capacity and well-rehearsed action plans to counter and prevent mis and disinformation as part of emergency and disease surveillance and response, dis and misinformation management, according to the experts, can become a familiar standard apolitical risk mitigation and health protection activity that is undertaken to benefit all citizens. And before I pass this on to Nargis once again, as clearly and compellingly presented by the research findings that we encountered throughout this process and the critical efforts of the panelists and organizations who are represented here, the flow of disinformation and misinformation will certainly continue. And I think we can all agree on this, unfortunately, especially as long as it is effective. And in the context of the pandemic, especially, we are hoping that research can support more mitigation of its impacts, which take the form of the final decisions and actions people make regarding their own health. And some good news stories include the WHO engagement with doctors and community leaders, especially that have been very effective because of national and international level actors, often viewed with a little bit more skepticism. And it's helped to support the local influencers on the ground in their discernment is certainly key. And we are just so glad to support the community of interest in improving the health outcomes. And I'm personally very much looking forward to hearing our panelists, to hear their sort of more localized, more local viewpoint on what some of their observed tendencies and trends are in terms of mis and disinformation in the country. And not that we're looking for the magic solution, but you never know. Hopefully we will be able to have a very fruitful discussion about some of the ways that we can all collectively, both locally, domestically, and also internationally, start thinking about ways that we could counter it, since obviously misinformation and disinformation, sadly, are not going anywhere fast. So thank you all once again.
Спасибо большое, Тинатин. Пара вопросов.
I have several questions. You said that 68 respondents in Kazakhstan said that the language is more important than political orientation. Could you elaborate on that a little bit? And second question, the messages that circulated in Kazakhstan, Georgia, and Ukraine, was there some kind of country-wise specificity of these messages? And if I may, my third question would be the following. Have you observed any intensification of disinformation, and what happened in these three countries when the coronavirus outbreak was at the peak, or was the disinformation flow remaining the same? Thank you very much. If I may, I would respond in English.
Thank you so much. So I'll start with the first one. So in terms of language playing a key role in terms of, as a comparison compared with political affiliation, what we meant by that, and what the respondents, in particular the media diary participants, as well as the media experts whom we interviewed, what they meant to say was that language was a very important factor in terms of dissemination. So the Russian language material was actually circulated and consumed more actively, irrespective of the political affiliation of the readership, as well as of the source that disseminated the material. So language in terms of pure consumption based on linguistics, and then in comparison with Ukraine, so there was a divide, about 36% versus 32% who preferred Ukrainian versus Russian. In Georgia, to be honest, other than the ethnic minorities, Georgian was still preferred. And then in Kazakhstan, just going back to Kazakhstan, the factor that that played a very serious, a very active role in successful dissemination, active dissemination of material based on language was that trustworthiness of the material that was consumed by the readership and the audience that consumed the news. There was a correlation there. So between sort of the language and trust. Political affiliation did not play a very serious role at all, according to the experts. Your second question was about some of the common themes that we identified between the countries.
Or differences, actually.
The differences, exactly, as well as the commonalities. So the differences, to be honest, between Georgia and Ukraine, we saw more parallels. And Kazakhstan, to me, was particularly interesting just from the standpoint of there were very different findings there. As opposed to Georgia and Ukraine, there were more similarities. In terms of even something small, like the way disinformation was treated as disinformation in Ukraine and Georgia, but in Kazakhstan, the respondents, the majority of them, as I noted, kept referring to it as misinformation and deliberately made a point of letting us know that in their viewpoint, this was not done intentionally. Russia came up far more actively as a source of mis or disinformation, primarily disinformation, in Ukraine and Georgia. And in Kazakhstan, there was more focus on actual public health and the concern that, that the respondents and the experts shared. Vaccine skepticism was couched in the development process and lack of transparency or thoroughness, as opposed to conspiracy theories. And conspiracy theories kept coming up very actively in our conversations with the experts in Georgia and Ukraine. And your third question, if you wouldn't mind reminding me, Nargis, sorry, I didn't write it down.
The timeline, in a sense, like,
yes.
Did we have the kind of some periods of intensification and then, you know, kind of the app flowing away? And also when Russia started having major problems, did we see any change, or kind of the flow remained stable, the flow of disinformation? You know?
Yeah. So I just want to mention that there is some fantastic research done by organizations such as Fact Check Kazakhstan, and in Georgia, the Myth Detector, that are sort of looking more closely at actually scraping the media for disinformation and for the trends. We were looking from a slightly different angle in terms of our research. We were interested in speaking with the experts to see what are the impacts on the local communities, the policymakers, as opposed to actually identifying the cases of mis and disinformation in the media and scraping specifically for that. We did scrape the sort of the open source media just because we wanted to gain a sense of what the trends were overall. But our focus wasn't really on the specifics per se and checking the temperature in that respect, in terms of the media, as opposed to we were checking for the temperature among the sort of whole of society. However, I can mention that in Ukraine and Georgia, the actual peak of misinformation, disinformation was with the side effects of the vaccines that were rolled out. So in Georgia in particular, that started when, I don't know if you recall, one of the nurses in Georgia, after receiving her first dose of AstraZeneca, passed away shortly thereafter, within a day or so. And that certainly did not help the whole vaccine rollout situation in the country. And we saw that in Ukraine as well, particularly among the military. So they're sort of after the vaccination of the military started, of the officers in the Ukrainian army started, once there were some instances reported of side effects. Now, whether or not that was disinformation or not, that's sort of a different conversation. Obviously, there was another peak as well. In terms of Kazakhstan, the one thing that that was very interesting to me when we were reviewing our findings was that the church, unlike the role that the church played in Georgia and Ukraine, which was different, in Kazakhstan, actually the church as a whole and the religious faith authorities, the trusted voices in the religious communities, actually encouraged people to get vaccinated, which was very, very interesting from the very start. So that to us was another big difference between what we saw happen in Georgia and Ukraine, in the different churches there, versus in Kazakhstan, where there was actually encouragement coming from the religious voices. I'm sorry, that was a very long and winding answer.
Tinatin. И последний вопрос.
And my last question, how many respondents did you have? Over 50, right?
In total of experts in the medical field, in the media field in particular, the civil society organizations and leaders. So we interviewed different groups of experts in all three of the countries. That was one research. And then the other part of our research on the ground was the media diaries. And we had over 70 participants in the media diary segment of our research.
Спасибо большое. Спасибо большое. Мы к вам вернемся. Slava.
Thank you so much. We will get back to you. Now, Slava, what perspective can you give us from the viewpoint of the media? That's a wonderful question. I was not prepared for this. We could get either too optimistic or too pessimistic, depending on which day it is. The day seems fine, but I still don't want to be too overly optimistic. What conclusions can we draw after the year of so-called infodemics? I won't be able to offer any recommendations like Tinatin has just done, but I hope I will be able to provide you with my opinion, my judgment about what kind of lessons can be learned from this situation. We entered this pandemic era badly prepared. And I mean not only the healthcare sector, and this was admitted by everyone, starting with the president of our country to all kinds of organizations. The Kazakh people were not surprised with this bad preparedness of the country for the pandemic, but we could feel the magnitude of the challenge only later, not at the beginning of the pandemic. We could see this confusion among the respective bodies. More than that, unfortunately, we have been witnessing for many years the total control of the government on the information, in the information environment. This total media control suffocated independent voices. We can count independent media on the fingers of one hand. And you should be aware that not all experts are brave enough to voice what they really think. On the other hand, we do not see any significant open public significant discussions on relevant political topics. So the state-affiliated bodies have been working hard for many years to establish this totalitarian regime, and this brought us to the unpreparedness for the pandemic. Let's try and use civilized language here to describe this situation, but in reality, at some point we hit the dead end. The ruling elite took advantage of the pandemic to gain full control of everyone and everything in the country. We suddenly found ourselves locked in our homes without any opportunities to travel around the country, film some videos for the news, for the media. A month after the setting of the lockdown regime, we were trying to investigate what was going on. Private media did not have such opportunity for quite a while. It was quite a lot of restrictions. There were quite a lot of restrictions and limitations. I'm sure some of you, dear participants, can understand this very well, can relate to this. We as journalists were trying to ask questions, to gather information, but it turned out we had no way to do so. The state body that was in charge of all the processes, coordination processes in the country, they started using Zoom 4 months into the pandemic. And as late as one day prior to the press conference, did we get a chance to know that. That of course can hardly be called a free access to information. During the first months of the pandemic, could be called nonsense or not effective attempts, lame attempts to control all the information flows. This led to further deficit of reliable information, and that created a lot of myths, and they actually bloomed. Everyone was trying to fill the gaps with their own made up ideas. We were full of fake news, misinformation, disinformation in 2020, and we still we are still there. The media have to be responsible for what's going on. At some point, it was clear how the situation looks. For example, last summer, we saw the emerging fake news and misinformation. We have these wonderful activists. One of them, one of the sources of disinformation, Shukhtar, he is a singer and a musician. Over a year, he was the leader in terms of disseminating disinformation.
It's absolutely obvious that he does not fact check at all. The young activists decided to check that, and they planted into their stories an absolutely fake story that allegedly happened in Vietnam with planes, with airplanes spraying COVID from up there. It was completely fake. They tagged this guy on Instagram and he distributed it immediately. And he said, like, see, we get the confirmation. We knew it. We knew that they sprayed it from airplanes. So we watched the state, in this case, many other cases, watched the government do absolutely nothing to prevent the distribution of such info. Last year, the government desperately fought the political activists traditionally. For instance, they arrested and put under arrest for 2 months Ilnur Ilyashev, a political activist. You can love him or hate him. You can think of him as a populist. It's your right. But Ilnur had the right to express criticism, and he was devoid of that right. That he was distributing fake information during the emergency. So the state made him silent using pandemic as a pretext. And we saw such attempts many times in 2020, but we saw 0 attempts from the government other than proclamations from the government that they would do something to prevent such fake information from being distributed. I can tell you lots of names of people, they're well known to the ones who are interested in the topic, people who are responsible for the disinformation, people whose actions led to, oh, my cat's here to support my thoughts. So you can hear some of the sounds coming from my cat, so sorry in advance. So the names of these people are not well known, but we see no attempt from the government to prevent their activity. And it seems to me that in this case, we must realize, must be aware that the government could have done more, but it was their decision to abstain from serious measures, to not fight for the truth. So they did not fight the disinformation. They did not work to stop these fake bits of information. Another important trend I'd like to draw your attention to before concluding, it was obvious quite a long time ago that social media, with the weakness of traditional media, including the online magazines, the social media for Kazakhstan citizens are a very serious source of information. They get news there, they get into discussions, they express opinions, they find out about happenings. Unfortunately, the year 2020 showed that the social media gets a lot of lies gets distributed on the social media. There's a problem with critical thinking in our country. It's obvious too. And in my opinion, this is also the result of government's efforts to suppress critical thinking, because a lot of humanitarian disciplines aimed at teaching people critical thinking are coming out of the curriculum or stepping out of the curriculum. There are a lot of disciplines that are just not taught at schools anymore. This leads to what we have. So social media last year, unfortunately for Kazakh people, became the source of expertise, not just information, but expertise. And of course, I think that in this case, the only way to solve this problem is to replace these pseudo experts who allegedly give their recipes, recommendations, maybe replace these people with some real experts. And unfortunately, a lot of effort is made by many people, but we don't have this large-scale result that would allow us to say, okay, we won, we can exhale and relax for a moment. Asel Musabekova will speak after me. She represents MedSupport.kz. She is one of those fantastic people who have been working 24/7 for an entire year trying to stop this influx of fakes. They did that with no support of government, but with critical pressure from the government. Nevertheless, they were quite successful with this task. A lot of my colleagues, including fact-checking KZ, did a lot of fantastic things in order to bust, not just to bust the myths, but to respond to the disinformation. I think the main summary point, or maybe several summary points, are that first of all, it's high time for the government to understand that monopoly for information leads to exactly these results. If the government fails to learn this lesson, we will see these flows of disinformation in other spheres too, for as long as it takes. And we will become a field for experiments, an object for study, for critical mass organization, and so on. You know, Kazakhstan people, are those who demonstrated one of the lowest results in voluntary vaccination rates. This is the result of Gallup study. The Kazakh authors did it too. Among the attendees, I've seen it. I've heard this info. 25% of only 25% of people are willing to get vaccinated. This is a horrible result of this disinformation, and we need to stop for a moment and understand we should stop trying to privatize this information field. Give the voice and give the floor to various people. Listen and let listen, speak and let speak. It's critically important to, it's very important to replace this pseudo expert by real life experts. There's a project supported by the US Embassy, and was implemented in late 20, and it ended this year. A group of medical practitioners learned to work with social media and became more visible in social media and started replacing pseudo experts. I wouldn't like to hurt anyone or to badmouth anyone, but many of the Russian experts or pseudo experts just infiltrated our information field and completely replaced Kazakh experts. So this media field is a very important piece of work that should be continued. Thank you very much. Thank you, Slava. I totally support everything you said. And just as you said, there is domination over the information field, but it's selective. It's like a lawn around the White House, you know, and all the other plants growing around are just unkempt weeds. So these weeds are very, very dangerous. And the pandemic exposed huge problems with the government, with the society. And we must, of course, rethink the right to information, the right to get access to the information as one of the basic, critically important societal interests. We don't have this general understanding that we as citizens must have the right to access that information, and the government also needs this truthful, precise, accurate information to enable them to function better. And the government was so fervent in February with all of these measures, and then they suddenly just got too relaxed. It was very understand why that happened. Thank you very much, Slava. Let's give the floor to Asel. As Slava said, the government just got a little bit confused, but some of the more advanced citizens did not get confused and turned out to be pretty prepared to the challenges. And Slava mentioned MedSupport.kz. Asal, please tell us what you did.
For this meeting and for inviting me. And as well, of course, I would like to thank Jordan and Tinatin for your research, because for me as a scientist, it's very important to see the actual data and not just speaking about this problem, but actually to see the numbers. And that'd be very, very interesting when you publish the report, of course, to look at all the methods and statistics. It's great. Yeah. Thanks very much. Спасибо, Slava, потому что вы тут рассказали.
Thank you very much, Slava, because you basically covered half of what I wanted to voice. A little bit about myself. My name is Asel Musabekova. I'm a scientist in the field of viruses, vaccines, and a year ago, I entered into the social media. Before that, I had no account in Instagram. I had a merely that account on Facebook. And a year ago, I took a look at the comments under sort of posts, and I thought it was a nightmare. It was the time of the beginning of the pandemic, April of 2020. And at that exact time, there was this moment when we discussed the healthcare code and the vaccines. So I studied vaccination at Pasteur Institute, and I studied a lot. So I was shocked by most of the people who post comments. They don't know the difference between a virus and the bacteria. So in the social media, I found out that we can't see, the experts are not visible. The young ones are not visible on the media. We had a very lopsided presentation on the internet. The official scientific point of view in Kazakh social media, it was very scarce. Comments were flooded by fake news, and I decided that something has to be done. And in late May 2020, we created MedSupport project. Dana Agilbekova, the professor of Nazarbayev University, and Akmaral Tursunova, its lawyer, a medical doctor, PhD in medicine. So the purpose was to translate the studies about coronavirus into Russian and Kazakh language, so that the doctors are up to date with the current information. Any epidemic, any pandemic is a war on infection, and the data was replaced by newer data daily. So we're not talking about just about Kazakh field. We're talking about the global field. The Trump's administration brought about a lot of fakes. So this problem is ongoing, very fierce. We hear Boris Johnson talk about mutations, and it sends shivers down my spine. It's just shocking. This problem here is in Kazakhstan is worsened by the medical practitioners who don't speak English and don't speak scientific English. They cannot consume the English language scientific information quickly. So they had to stop and learn English in order to read these articles, which is unrealistic. They don't have time for that. So our purpose was to help medical practitioners understand these studies on coronavirus, the most recent ones. So the community came to a conclusion that not only the doctors need this awareness raising, but everyone does. So this social media, mostly Instagram, is of utmost importance right now in fighting fakes. But it's also responsible for distributing fakes. Currently, as far as I remember, over 25,000 followers are on MedSupport account. So this account helped just regular citizens help them find answers on how to fight the virus, which vaccine you should choose. Can you get vaccinated if you had a particular disease? So there were thousands of questions in the direct messages, thousands every day. So just regular, general, logical questions about coronavirus. And this is all job done by volunteers. It's kind of an invisible piece of work, but this community did a lot during the pandemic. We have about 100 people in the community, in our group, and the vaccination campaign, without any fake modesty, I can say that the vaccination campaign was successful thanks to medical med support. Also about the first wave of the pandemic, what happened? When everything broke out and the coronavirus appeared, I remember there were these comical announcements by some of the state officials. Some of them said, a virus will soon be here, looking forward to it. Oh, there we go, there we have it. So, you know, it was comical, but it was desperate. It was a confusion. Everyone was confused, of course, but the confusion in European states or in the US, it was attributed more to state officials or to medical doctors or to decision makers. It was not, so the general public, they were not confused. But in Kazakhstan, unlike the entire other world, everyone was confused. The general public was confused because most of the problems were because of the so-called self-medication. Our medical system allows completely free and unrestricted, unregulated sell and buy of antibiotics, dexamethasone, in the form of injections. People just gave themselves shots of dexamethasone in their own thighs, and there were inflammations, awful inflammations, and they couldn't even get medical help at hospitals. So the pandemic, the victims of the pandemic and the deaths as a result of a pandemic were due to this miscommunication, misinformation, and believing in these folk recipes. So this was because of our failing control system, restrictive system. We were talking about dexamethasone. The BBC had this article. They said it was a wonderful, super efficient treatment. The dexamethasone, we were out of dexamethasone in a couple of days. While it's critically important for some autoimmune diseases for other patients, so it led to a large chaos. So erythromycin, one of the antibiotics, there was a rumor about an alleged scientific article that it's good against coronavirus. So this contact, this knowledge, the spread of the knowledge was detrimental here in Kazakhstan, because in France, such a piece of fake wouldn't have done much chaos because they have a restrictive system on the consumption of drugs. But in Kazakhstan, it did. It spurred chaos. Uncontrolled antibiotics, the antibiotic resistance. This is one of the negative results. Say tuberculosis, Tinatin. We use it even with children. Children come to are brought to pediatricians, and nobody can, nobody can treat them. Sepsis and even death. Antibiotic resistance leads to all this.
So we can say that this resistance peaked after summer 2020. This is really scary, even scarier than coronavirus. We can face dire consequences quite soon. This was my point number one, uncontrolled antibiotic administration. And the second point is the traditional alternative medicine. Now in Kazakhstan, it's so popular. There are a lot of bloggers who speak Kazakh language. They have audience of about 300,000 people. Masseuse treats the coughing resistant coughing with the blood of pigeons, so you can understand the level. And a lot of people are consuming these materials. They are reading and watching this blog. So you can find whichever alternative medicine you like in our media. There are, of course, a lot of expensive luxury clinics that treat infertility with all kinds of nonsense. We really need the state to clearly communicate what should be done, what should be supported. And on the contrary, the public authority, public official, top public official in the healthcare of Kazakhstan publicly said we are going to support the alternative medicine. This is, of course, something that confuses us, the scientific community. We understand how dangerous this alternative medicine bullshit can get. Point number 3, systemic issues of the primary healthcare and hospital admission processes. Why? Because we had a lot of symptom-free people admitted to hospitals, and actually it led to waste of resources. Nurses and doctors were staying in hospitals for months without going home. And then when we asked what was the purpose of this kind of decisions, they had no sound answer. They said that symptom-free patients are going to transmit the disease further. And this was a huge waste of resources, both financial and human resources. This was in conflict with all the recommendations of the WHO and other organizations. So it's against all the common sense and all the internationally recognized protocols. I said at that time that the clinical protocol we are using in our country is wrong, and I received this wave of aggressive responses from bots, chatbots, and after that I decided that we really need loud voice of sound experts who could voice what has to be said. This is how I had this idea of communication in the academic community. I wanted our young scientific people to be seen and heard. And I wanted the international scientific standards to be popularized in Kazakhstan. Together with Anastasia Gornobunova, a journalist, we initiated this platform. We work on a weekly basis. We invite a scientist every week who tells us about what he or she is specializing in. We really want this kind of popularization of science. I did not expect much of this project. This was my first media project, frankly speaking, but I was really inspired. I received so much support from our audience, and I received a lot of support from the Kazakh scientists who are working hard and who are willing to speak publicly about the best practices in science. We are really lucky. Now I'd like to tell you more about the mentality and the way we communicate with our audience. For example, when we speak about vaccination, quite often we hear something like, we cannot speak openly here because people are too dumb. We have to use simpler words, and we shouldn't use any complex messages. We don't need to explain complex ideas. In fact, this is not the case. Only sound information can do the work. When we speak about COVID vaccines, there are so many questions to be answered. We haven't seen RNA vaccines. We have to start talking about this. We have to try and find simple explanations of these complex things. Otherwise, people who are prone to misinformation and this alternative medicine, they will go away from vaccination. So I keep saying that we have to try and stop blaming the mentality of general public. That's not true. Ordinary people are perfectly capable of understanding complex things. We can also remember how the vaccines have been developed. For example, Pfizer developing their vaccine. In a week of the start of this process, they had the first vial to start the in vitro trials. We now see that small flexible companies are working more effectively, and those companies that are agile, that are publicizing their recent discoveries and developments, as they go, they do much better. If we speak about Sputnik, we see how many errors and mistakes have been made. We know that Gamaleya was working on this kind of vaccines. The scientists behind the Sputnik are great, but communication is poor. Putin mentioning his daughter getting her vaccine. This is something that we see as a negative light for the Sputnik vaccine. Once I started talking about this vaccine, I was blamed of supporting Russia, even though a week prior to that, I clearly said that I do not support this vaccine. So again, politics rather than science in selection of a vaccine is a bad approach. And we have to be as clear as possible in communicating the data behind vaccines. Now this Kazakh vaccine, the trust towards scientists is really fragile. We just start the process of building this trust. Why? Because for 30 years, we have not been talking about our domestic developments, and we cannot build trust overnight. So once again, we have to have our scientists be seen and heard. I would wrap up with a positive message. I'm really happy now that science and scientific data are available, accessible for ordinary people, and that people can roughly understand what RNA vaccines are, whereas in the past it was available only to scientists. I'm sure this is going to improve the general level of awareness. I hope that we will eventually improve the level of healthcare and everywhere, starting from schools. I recently had a talk about art helping us understand science. I believe that the pandemic, which caught us off guard, still makes us some good. We do have a lot of activists, volunteers who are ready to share their resources, time, and energy to help everyone overcome this crisis. The state has to support the work of volunteers and this great human resource we have. Thank you so much, Estelle. Thank you for two important project, Kalim Faces and Med Support KZ, and for staying optimistic despite our negative mentality. Go ahead. Good luck with your work. I am happy that you mentioned education sector, because I am convinced that we have to try and improve this attitude, this negative attitude, starting from primary school or even earlier. And we can sow this scientific thinking starting from very early age. I have small children, and I now recall this French cartoon, maybe you know it, about human body. They have very simple animation. It's really amazing. A series of short videos where they explain how our organs and systems work, like blood, what it consists of, and so on. It's so interesting. We have to really work hard to improve the image of science. Yes, of course, we can have a lot of regulations in place about the administration of drugs, including antibiotics. But anyway, people will always able to find some bullshit like pigeon blood, or I don't know, some stones to treat well-treated diseases. I can see a message about alternative medicine and allopathic medicine. Maybe our participant is saying that the alternative medicine is not that bad. In China, we know the state supports alternative medicine. Could you elaborate on this?
When we speak about traditional medicine, of course, we also can speak about, for example, artemisinin, which came from Chinese traditional medicine and which received Nobel Prize, right? The anti-malaria drug. Of course, there are remedies which work. For example, curcumin, which works for some of the diseases. But the problem is that in Kazakhstan, it's very difficult to control in terms of law. And what is being done at the moment in Instagram is a complete opposite of what was done, for example, for artemisinin, where this is unmeasurable, uncontrollable, commercial use of, and this is playing on emotions, basically. And so basically we have medicine which is evidence-based and not evidence-based. And traditional medicine is partly evidence-based, and this is the part that we want to focus on, yes. But from the governmental point of view, we don't really see this discussion going on. We don't see the discussion which will aim to control this and to make this evidence-based. So that's why at the moment I basically advise people better avoid this, because this is very much out of the control. From my point of view, and this is now at the moment more harm than good. So, but thank you very much for your point. Of course, this is very important.
Спасибо большое, Асель. С нами тут находится также Ботагош Ракишева.
Thank you, Asel. We have Botagosh here from the Public Institute of Public Opinion. She had this study conducted in 7 countries, including Kazakhstan, and she would like to share the results. Can you hear me? Yes. Greetings from Nur Sultan. Thank you for the opportunity to speak. We had a research done at the beginning of this year, before the rollout of vaccination. Our institute was commissioned by the Asian organization, major Asian organization, and we had Kazakhstan, Kyrgyzstan, Mongolia, Georgia, and other countries. The results are really actually very interesting. During that period of time, at the beginning of 2021, before we had vaccination rolled out, we had 1,000 respondents in each our country. We had a representative sample of respondents. 23% of respondents in Kazakhstan said they would be willing to get vaccinated. It was the lowest rate in all the countries. We were really shocked. We shared this result with other projects, and they shared theirs. And actually, the results were similar throughout the projects, up to 30%, not more than 30% of respondents in Kazakhstan were ready to get vaccinated. It turns out that people just did not understand why they needed to get vaccinated. What was important was that people were eager to get sound information, but it was not available. As a social scientist, I would like to stress that we have to have enough information, not more than that. Otherwise, people would be overwhelmed and depressed. They will get suicidal, maybe. Insufficiency and overflow of information are equally bad. People need sufficient information, not more, not less. One more conclusion we had: we do not have sound epidemiological culture in the country. We are confused, we are lost, we don't know what to do. What should we do in this situation? We do not have clear scenarios or algorithms in our minds. I visited South Korea. We were there when China had this yellow dust spread in South Korea, and the state immediately published the instructions and algorithms. People put on face masks and that's it. Everyone was so calm and well organized. In Kazakhstan, we didn't have anything similar. That's why I would like to underscore once again, we have to facilitate epidemiological information and culture, as well as clear algorithms about what has to be done. I can share our research results with all the data. One more thing, one more point. We had field study for Internews about the media literacy in Central Asian countries. In 7-point score scale, we got about 3 points. That's also important. We have really low level of media literacy. I will share with you our report in both Russian and English. Thank you, Patagos. Did you have the figures about people who have these conspiracy theories about COVID per se? Or are you already muted? 20% of our respondents thought the pandemic was something artificially created. In Kazakhstan, about 17% of people consider the pandemic fake and artificially made. We have these non-believers, so to say. This definitely has an impact on the current situation. Pakistan, Kyrgyzstan, and Tajikistan are the leaders in terms of these number of these non-believers. How about the biological weapon?
We didn't go that deep. It was a small survey and not a lot of time. But the question that Tinatin mentioned, a very interesting one, on the mosques and churches in Kazakhstan, the spiritual community started to join it. 2 or 3 years ago, we had a COVID epidemic when a lot of children, an epidemic of measles, and many of the mothers did not vaccinate their children because they thought the vaccine had elements, ingredients made from pork. So the spiritual leaders made this explanation work, did this job on awareness raising. And we have this experience of working with the spiritual leaders who explained about the ingredients and extracts in these vaccines. Okay. Yeah, unmute the microphone. Yes. Another comment on measles. There's an outbreak still, about 13,000 of cases were in 2019. The religious case reason is not the main one. The parents in doubt maybe is the main reason. Together with UNICEF Kazakhstan, me and my team as the scientific team, we're doing the project called Vaccinate. So the entire COVID vaccination situation impacts the children's anti-measles vaccination system. So all information related to any vaccine impacts the decision of the children to vaccinate the children against measles, rubella, and so on. So this checkup is very important. I'll give you a small spoiler. There will be quite soon coming up is the material on children's vaccination during pandemic, the correlation between these two things. So please read it. There is there are responses on all possible questions: the cells, the jello ingredient, the extracts, and so on. So thanks for your notes about the human behavior during the pandemic. I'm a person who tries to be positive about everything and tries to find positivity in anything. And it's very cool that we finally brought this epidemiological knowledge from exclusively academic circles to the general public, and it will change the public behavior. People who work within infections, when we meet at conferences, for the last decade, we've been talking about the pandemic upcoming. So a pandemic on the coronavirus, the bats, so on in China, because of the overpopulation, we have to rehearse. Just as we rehearse the fire alarm, we must rehearse the pandemic response. We should explain it at schools. Like, what happens if the pandemic breaks out tomorrow? What should we do at our schools? How to do our educational systems work? So we should do this mistake analysis. Another brief point, another project to tell you about is this language problem. About the information, the excess of information and the scarcity of information. In Russian, there's mostly excess of fake information. Lots of mailing lists in Russian language, Russian experts, Professor Vorobyov, and so on. In Kazakh language, we have the problem of scarcity of information, and some of the Kazakh experts even said it was language-based discrimination in terms of access to info. Most of the state officials communicate to the people in Russian. Is that a problem of people, state officials, the government? In terms of language, we are starting to lose our language in terms of scientific or cultural discourse, epidemiological discussions, in terms of terminology, understandable phrases and words. It is becoming increasingly difficult to explain it in our mother language. It's a huge problem. We need to create content that is accurate and understandable in normal human language, not just smart speak or, exactly for this, we launched a project called Barat, information about vaccines on Instagram. What was important in this project? We have the Kazakh editor Natkul Kujakbek. She is revolutionizing the quality of Kazakh language. She's making it real, understandable, living language. We need to pay attention to the two because there's a lot of Kazakh language audience, Kazakh speaking audience who are pressurized by fakes, especially on Instagram, and these celebrities and other influencers with millions of followers use this lack of Kazakh language information in their commercial purposes. That's it. Thank you. Yes, I do agree that we need the protocols, but also we need the ability to study fast, because we will have other pandemics, different pandemics. We will have to react very briefly, very quickly. Masks in South Korea, we mentioned it. Maybe they're used to wearing masks, but here in Cambridge, Massachusetts, people put on their masks at once, immediately, although it was the first time. There was a feeling of solidarity that the pandemic showed, demonstrated it, that we don't have much of that solidarity. Some of the people are ready to just disregard their own health and the health of their fellow citizens, which is a huge problem that was exposed by the pandemic. We have another minute for a question to Tinatin. How did you define which disinformation was Russian originated from all of that info junk that was around? Thank you very much.
The media and the civil society organizations and experts to indicate the source of disinformation. We recognize that obviously perception is important as well as the actual situation. So our media landscape analysis that we conducted identified affiliated sources that are well known, but we explicitly did not conduct forensics or investigate social media threads, as that is being done very effectively by other organizations that were mentioned during these presentations today. Once again, we were looking more at the ultimate impact rather than the source per se, and by linking all of this research, we can hopefully create a compelling chain that paints a clear picture. And if I may, I'll just take a moment, based on the fascinating presentations by our fellow speakers, just wanted to reiterate a couple of points. First of all, the aim of our report, of TCM's report, was to explore the impact of disinformation campaigns on the ground in the 3 countries that we focused on. And as was noted by everyone, in terms of Russian disinformation, it will be very hard to make Russia stop. But what we can do, and part of that is today's conversation and brainstorming, is control, developing mitigation strategies against Russian actions in these countries. 2 things that were mentioned by the fellow speakers that I think are extremely important, and these were among our findings throughout our research, was improving transparency, particularly in the medical sector, and also pursuing an immediate depoliticization of healthcare. And this was seen not only in Kazakhstan, but also in Georgia and Ukraine, rather than presenting just a united front on effective public health policy. Domestic players locally, as well as the Russian actors from the outside, have used the pandemic as a political prop. We've seen that with COVID, and the pandemic certainly runs the risk of deepening already inflamed divisions and divides that we're seeing. So further measurement and policy decisions on COVID measures should certainly be presented to the public by multi-party teams of political figures, experts, policymakers, particularly in this case, medical personnel who are well-trained. And of course, critical thinking is of absolute and utter importance. And this was reiterated by, I think, every single respondent that we spoke with, not only in Kazakhstan, sadly, also in Ukraine and Georgia. And one of the sort of Soviet legacies that we are still wrestling with is this decline in critical thinking, and of course, updating the skills of medical personnel with the most up-to-date information and sources and academic articles that are available in multiple languages. I could not reiterate it more based on the conversations we've had locally, but also you have all voiced this. So thank you very, very much. And thank you for having us. This has been absolutely fascinating.
Thank you so much, Tinatin. And we're a little bit over time, but I would say 90 minutes passed by very, very fast. And I think we all learned a lot from each other. And I want to thank the panelists for their great inputs. I want to thank the Oxus Society for hosting this, for organizing and hosting this meeting and this roundtable, and so the critical mass for doing this report, and the audiences for joining us. Thank you very much.
Thank you all. Спасибо огромное всем.
Thank you very much.